Hello and namaste from Mumbai. This is Dr. Gaurang here. I'm a homeopath based in Mumbai. So, this is a very interesting podcast on menopause that we are talking about, and especially homeopathic strategies in menopause and perimenopausal health. And in the last few years, we've been treating quite a few cases of different um, kind of syndromes in and around menopause. And homeopathy, especially in today's times, with the idea of classical and contemporary homeopathy together, and using of a lot of newer ideas like sarcodes, fungi, lesser known remedies, tautopathic remedies, I think has really opened a totally new um, kind of avenue to understanding and solving many different pathologies. So this is an interesting podcast. I hope you listen to it and do write to us. What did you think about it? The email ID is gaurang@gmail.com. GAURANG at the rate gmail.com. And all of you who watch this, who listen to this podcast, um, you can write an email on this and you get a special discount on our new course, Homeopathy in Autoimmune and Musculoskeletal Disorders. It's a 30-hour course, and you get an access for 2 years. So you get a special additional 35% discount on this. Write to us. And also, of course, anyone who listens to this podcast gets a special discount on all our books. I've written a bunch of books, Decoding Mental Rubrics, Materia Medica of Nosodes and Sarcodes, Value of Repertory, Acutes and Maps, and my recent books, Homeopathy in Hormonal Healing in Women. So write to us, GAURANG. Thank you. We are going to talk about menopause and perimenopausal health, and especially homeopathy and homeopathic approach. So, what we are going to do today, we are going to have a differential diagnosis of remedies. I will attempt to share about 25, at least 25 odd small remedies and how to use them in clinical practice. As we discussed last time, I'm going to summarize the case and share with you because I'm going to discuss with you about 4, 5 cases. Now, the cases may be much longer cases, which may require an hour, hour and a half, sometimes lesser. But I'm going to summarize to you those cases in 5 or 7 minutes. So I'm going to really shorten the main idea of the case and discuss with you. So that's the idea. So let's start with the first case. This is a case of approximately a 50-year-old woman who came to see us with the main issues at that moment of hot flashes and a lot of dryness of the genitals. And she also has borderline scleroderma. And with that, she has eczema and a lot of itching and bleeding, and especially more when it's hot and warm. And she's suffering a lot. She suddenly get heat flushes. Suddenly, the body becomes hot, swollen, redness. Yeah. Suddenly, it's painful. Suddenly, there is a lot of itching in her genitals. There is a lot of dryness on her body. The nails are getting brittle. The one thing that I observed about her is that she's very animated in the way she talks. That's the first thing I observed. She is very animated, very vivacious, full of life, moving, and throughout the whole consultation, she was very emotional in between and then was okay. So I try to ask her, tell me about what is it for you? What is it that's affecting you and your health? The first thing that we observe about her in her entire case is she's very anxious. Even even a small boil on her hand and she's very anxious. What's going to happen? What will happen? What's the worst that can happen? Is it cancer? Is it this? What will happen? So there's a lot of kind of a big fear, big hypochondriasis is there. I ask her, go a little deeper. She says that, he can take me away. God can take me away if he wants. I don't want him to drag the disease. When we try to go a little deeper, she says, I feel suffocated. I ask her, tell more. She says, I feel like breathless, suffocated. This is my very deep experience. I feel totally helpless. Tell more. A little bit more about this suffocation. And I feel very small and insignificant, like I am a small stone not contributing to humanity. I haven't done anything. I'm so small that I'm of no kind of consequence anywhere in any case, she says. What dreams do you get? She says, one dreams that I see again and again of all the dreams, and she spoke many dreams, but the main dream she speaks is, this is very strange, doctor. I see we are near a ocean. A large wave, big wave is coming, and I'm with my sister, and I'm just grabbing my younger sister. I'm trying to run away, and the main feeling is I'm trying to protect myself, but it's not happening. And then I get up. This is a dream that she says she sees again and again. And again, here I see that she's getting very emotional, very sensitive. Towards the end of the case, she says that, doctor, definitely I'm towards the post-menopausal stage of my life, but it's very strange that my sexual desire is very high. Now, this is not something which was there previously, she says. The sexual desire is very, very high, especially now also. Very interesting. She cannot bear tight clothing at all. She's generally very hot, thermally. She likes sweets also. Some more observations about her from the notes, and there's a lot of history of being in her childhood when she was younger, history of being sexually abused, um, caused a lot of trauma to her at a deeper level, although she doesn't speak so much about it. Her sisters are also our patients, and her talk, they say, is quite sweet, but she can be very manipulative also. Her skin has a lot of bluish reddish discolorations. There's a lot of burning in the palm, soles, heat flushes, and this is better by cold application. And like I told you before, she has written about this in the case form that we give, that she has a very high sexuality and she kind of feels wet all the time, most of the time. She has done some reports. There are certain kind of patterns there in the symptoms that they are seeing. The ANA is borderline and so on. So this is the case in short. And just like in every case, the whole idea, the way more and more I'm trying to analyze the case is connecting the classical homeopathy, which a lot of my cases are based more on repertory and materia medica. And I use a lot of newer ideas from a lot of homeopaths of today's generation who give a lot of themes, concepts. I often use these kind of ideas to differentiate remedies. This is something that I do more and more. Yeah. So what did I think? Just to make the long story short, I gave her a kind of an interesting remedy. Let's have a look. So she used to get a lot of itching in her genitals since the climax's time. Her sexual libido was increased and very high sexual desire. A lot of dryness that she feels in the genitals. Constant dreams of sea, of ocean, burning, burning, and a lot of anxiety and a state of hypochondriosis. And you can see a very, very interesting remedy coming up here. But what I also found out is that in the past, she had taken a lot of estrogen kind of related allopathic medicine, the estrogen replacement therapies, and so on. So that had made a lot of impact on her health. So, in many such cases, like you have discussed and you have seen some of my cases before, what I often do is, along with the homeopathic remedy that I give, after a few days, I may think about giving a tautopathic remedy. What is tautopathy? Tautopathy basically is the idea where if certain allopathic medicines are taken by the patient and that has affected their health, then we look at a potentized homeopathic remedy of the same material, hopefully, that can remove the toxicity of it. And this is something that was started by an Indian homeopath, R.P. Patel. So coming back, so what did I do? So I gave Murex 200, right? Murex 200 2 times a day for 2 days. And after 3 weeks, after waiting for 3 weeks, I gave estrogen 30 2 times a day for 3 days. So this is the tautopathic, what I was telling you. And after that, she was on Murex, more or less 200 every 2 3 weeks. And with help of that, her eczema within a month almost disappeared. Her dryness was remarkably better. Heat flushes went away. Um, we continued Murex. We later on went to Murex 1M. Her dryness of the vagina is still there, but it is much better. Her discoloration improved, and she did quite well. She did quite well on Murex. So Murex is one of the remedies we are using a lot during the menopausal phase. And this, I want to talk to you not only about Murex, but I want to talk to you specifically about the C remedies. C remedies are very important remedy for hormonal health. So what I have seen are some very important patterns related to the C remedies. And we already know the C remedies so very well, starting from sepia, right? Murex, Medusa, and so many we have. Most of the C remedies, what you will see are by nature, by their personality, by their very, very basic state. They can be very naive, very impulsive, not very, very evolved, sometimes oversensitive. Most of them I have found to have some kind of endocrine and hormonal disorders. PCOD, thyroid, polycystic ovarian disease, thyroid. This can be very common with them. Most of them I found to have allergic and autoimmune pathology also. Most of them are always better by movement and exercise. So if you ask them, they will say, for example, the main symptom of CPI is running very, very fast makes them feel better. Many of the patients who require C remedies are addicted to yoga, for example, and they are crazy about yoga, Pilates, and all these kind of thing, and they feel much better physically and emotionally with that. They can be very sensitive to music also. And the other pattern you will see is, of course, the connection to the source, sea, water, and they feel much better around the sea. So these are some very important kind of patterns of the sea remedies. But Murex is a huge remedy. To tell you in short, Murex, if I have to tell you in a gist, it's known as a highly sexed sepia. So which means that you will see the sepia state, maybe, but will have a very huge sexual desire. This is one of the biggest keynote. And very often with Murex patients, I've seen that they get a pain towards their kind of left breast. They get a pain, acute pain, which is diagonal, it goes from here to the left breast. So this is a big keynote that is often a very, very important confirmatory symptom for Murex. Murex has a very, very high sexual desire. So there are symptoms like nymphomania, with suppressed menses, nymphomania during climaxes. There is a state of depression and there is a state of hypochondria in murex. They can also be very affectionate, shameless in that way. So it can come as a very important differential diagnosis for phosphorus and hyoscyamus. They can also be very obstinate. They can also have a lot of claustrophobia, which you saw, which understandably a lot of it is a clear pattern of mollusk as a family, which we already know. They can be very depending, clingy. Yeah. This is a big keynote that I often see in Murex, sinking all gone sensation. They feel as if there is a sinking sensation, and this sinking sensation in the abdomen is also there in sepia, by the way. So it's a little bit about we discussed about Murex in this case. And what I'm going to do now is, of course, I'm going to throughout the talk to you about differential diagnosis remedies and so on. But the first topic that we will take about menopausal health is heat flashes. And this is, of course, one of the commonest symptoms that you will see during and after menopause. The biggest remedy that I often use is amyl nitrosum. Amyl nitrosum. This is a huge remedy because you can see it has a pattern of nitrogen also. And that's why this remedy, and I remember a very interesting case of a woman around the perimenopausal phase. And when I studied her case, she had a thyroiditis, that is the inflammation of thyroid. And her main symptom was heat flushes, and she would feel better by open air. And when I studied her case further, I found a very interesting thing that she had a huge kind of a history of grief, a lot of sadness at a deeper level. And when I studied her case further, I found a very interesting rubric you can see in Fatak, goiter from grief. And one of the remedies, amyl nitrosum. This is a huge remedy where the women typically will have heat flushes, will have thyroid related issues, will have hypertension, and there will be a deep history of grief. And it's a very underused remedy that we often see. Of course, there is a lot of claustrophobia because of the nitrogen kind of patterns in amyl nitrosum. And they feel so much better after open air. And there is heat there is heat flushes, then sweat, then coldness. So you will see this cycle, heat, flushes, sweat, and then coldness. It's only one remedy in Fatak, amyl nitrosum. And they also have a lot of sudden fear that something bad will happen. This is something that you'll see with amyl nitrosum. Some more kind of remedies for heat flushes. And I'm telling you the commonest ones that I use in practice. Another one that I use a lot is a remedy called as jaborandi, also known as Pilocarpus rutaceae family. This is another huge remedy in my practice for heat flushes, but it's not only for heat flushes. The keynote that I often see is this heat flushes typically can have palpitations along with it, but it could often be one-sided. So one part of the body, like the patient, Jaborandi patient often comes and tells me, I get the the sweat only on the palm, only on the forehead. I don't know why. So this is a big keynote that there is a too much sweating. So the word written in boric is abnormal sweating. You can see in boric materia medica. Abnormal women, 55-year-old menopausal woman tells me that, doctor, it's so much sudden sweating. I don't understand. They are telling to take hormonal treatment, but so much sudden sweating. Only one remedy, remember, Jaborandi. Yeah, this is very big remedy is Jaborandi and Pilocarpus. The other thing about Jaborandi, which I have confirmed, is they often have eye-related symptom. They have around the menopausal symptoms, they get a lot of eye-related symptoms. Just have a look. Let's see.
You can see in boric written. This is the important thing about boric. When you read boric materia medica, always read what is written in bold. That is the main clinical thing in that remedy. And if you read jaborandi, the main thing written is abnormal sweat. This is the word I want you to remember about pilocarpus. And the other thing I told you is the eye symptom. Around the menopause and after menopause, especially and even without the menopause, these women could often, because of too much of reading, too much of screen, this thing, they get a lot of dryness inside the eyes, and their eyes tend to tire a lot. They feel, oh, I'm very tired. My eyes are very, very tired. They get headaches. They get what is called, we call it in India, we call it as a computer syndrome. I don't know what's it called in Germany or Austria. What is computer syndrome is someone who works too much on computer and then they get a headache, they get a neck pain, they get eyes of eye, dryness of eyes, pain, this thing, a lot of huge eye strain. And one of the very important remedies is jaborandi. So this is a remedy we use a lot. So as well, this 200 2 times a day for 2 days is called a split dose. This was started by a great homeopath from Kolkata. Okay, from Kolkata in India. His name was B.N. Chakraborty. Right? Another remedy which we use a lot in cases of heat flushes is boric acid. Okay, this is especially a very important remedy. All acids are important for menopausal health, but boric acid is a huge remedy. It's normally not think so much about this. But what is the keynote? And I'm telling you just the keynote. When around the time of menopause, diabetes comes up. And it's very strange, why did diabetes come up after menopause or around menopause? And suddenly there is heat flushes. The big and the main remedy is boricum acidum. So that's the keynote that I would like you to remember about boric acid. Of course, my idea is to, for you today, is just to give you some clinical hints about all these different remedies, lesser known remedies that we use in practice. And then you have to study and apply. One more keynote of boric acid is coldness. So they feel very chilly inside, right? Like Cistus canadensis. So chilly that they have a symptom. You can see this from Clark Materia Medica I'm reading. Cold vagina felt as if cold, as if packed with ice. Coldness everywhere. Coldness of vagina, coldness of saliva, coldness of everywhere in the body. This is boricum acid. Never forget snake remedies for menopausal health. And the most important snake remedy, because one of the keynote of reptile remedies is that better by discharge, okay, better by bleeding. And what happens in menopause is the menses stops, and that is when a lot of symptoms of reptile patients develop. One of the important remedies, Crotalus horridus, that we are using. And Crotalus horridus, one of the main things I want to tell you about that is it's known as the most shy snake. The Lacus is a charismatic snake. Huh? Crotalus cascavella is a snake who has a lot of fears. Vipera is someone who's very sensitive to injustice and so on. But Crotalus horridus is the most shy snake of homeopathic uh, that we have. And it's a big remedy for menopausal health. In fact, if you ask me which is the most important reptile remedy for menopausal health related issues, it's Crotalus horridus. So the face is often flushed during the menopause for Crotalus horridus. They get a lot of giddiness. They start getting some noises in the ear. So many women who get like a Meniere's disease around the menopause, there's only one remedy in repertory, that is Crotalus horridus. Suddenly they start feeling weak. Suddenly they start feeling fainting. Crotalus horridus. One last remedy which I want to tell you about menopausal health, which I think we tend to forget in heat flushes. And this is actually the favorite remedy of one of my teachers, Dr. Sarkar. He uses this remedy a lot in menopausal hot flushes. He says if you are confused in heat flushes, the first remedy you should think about is Morgan Pure. Okay. Morgan Pure is a bowel nosode. And mainly we have about seven bowel nosodes in homeopathy. Mainly. And of course, we are going to talk about the entire journey on bowel nosodes and how to use it in one's practice. And my God, I cannot imagine practicing homeopathy without bowel nosodes because they are so important intercurrent remedies in homeopathic practice. For example, we were discussing before we started about prostate health. For prostate health, the biggest kind of important bowel nosode is a remedy called a psychotic compound. It's a very important intercurrent. For example, so the biggest and most important bowel nosode for menopausal health with heat flushes and so on is Morgan Pure. What is the keynote? I will try to tell you. The main keynote is congestion, redness, like sulfur, like belladonna. So these menopausal women will get a sudden heat flushes and their hands and feet will become hot. We don't know why. This is the keynote of Morgan Pure. And very often these women later on with the menopause, you can see very nicely will start developing what you call as gallstones. So we know that menopause is a very important phase for gallstone and gallstone colics. But Morgan Pure is one of the most important remedies for women around menopause to develop gallstone. And this remedy has in it to heal that from a deeper level. So that's a little bit about Morgan Pure. We will, of course, discuss so much about it in our talk on menopausal health. Let's go to the next case. So this is another case we saw around a few months back. 50-year-old lady. She came to us with a lot of joint pains and a lot of menopausal health related issues. Let's have a look what she came with. So she describes a lot of back pain since last few years. She describes the pains with a lot of stiffness, a lot of drawing sensation. This pain is worse on lying down and she feel better after massage. She also describes a lot of left shoulder rheumatism with a lot of pain around the elbows with numbness. Yeah, she cannot put her hand up like this. It's very difficult for her. And when we ask how it started, and she says that it started a couple of years back due to overexertion and especially during the time menopause started. So all her problems seem to surround around the change in life during the menopausal lifetime. This is important for us to know. Tell more about yourself. And she describes about how in the past she had frequent viral fevers, how she had a history of a lot of back pains and shoulder pains, and so on. And that's when we speak about tell me about yourself, yourself at the deepest level. And she describes herself as someone who's, of course, very sociable, very jolly, but someone who really likes to help others. That's the most important thing for her, to go and help others and go out of the way and help others. And I asked her to describe this a little bit more. And she says that my mother's health isn't very good. She's paralyzed. And to see her suffer, to see the pain that she's going through, I'm very sensitive to this kind of pain and suffering that she goes through. And she's very emotional when she talks about this. She also says she's very triggered by rudeness and disrespect, especially if someone disrespects her. Then she says further, I can't hear any bad news at all. I'm not so strong, doctor. I'm so sensitive, doctor, that imagine if someone has died in a particular area, in a particular hospital, or someone dies in the family, I will not go there. There's a lot of fear of this kind of suffering, pain, sensitivity. It impacts me a lot. In the past, if someone dies in the same building, I will not go out of the house. I would not get sleep at night. I would be so sensitive. And even in the hospitals, the pain, the suffering, the needles, the injections. My God, I very sensitive to it. So she was very emotional when she spoke about it. And this was the main thing that she was talking about throughout the case. She gets a lot of heat in the palms. She says this is a symptom that had started after menopause. Since the menopause started since 2021, previously her flow was okay. She had taken a lot of estrogen hormonal pills in the past for her uterine health, for her menstrual health. And throughout the case, she talks a lot about pain and suffering and hospitals and needles. And even while talking about this, my colleagues in the clinic could observe that she was very uncomfortable talking about this. Some observations from the sister, her sister had also joined us. She's very anxious by nature, very careful about family. And very interestingly, the sister tells us that she didn't marry because she was looking after her mother. So some of you already know that in India, there is a kind of a culture that we live in a house with the entire family together, the mother, the father, their grandfather, the brother. So there could be like 14, 15 people living in one house. So our particular patient, she decided not to get married because the mother was suffering, and everyone else in the family, of course, got married, but she only wanted to take care of her mother because she was suffering a lot. So this is her deep level of sensitivity. And so this is about her. She is very kind of conscious. She doesn't want to hurt anyone. She likes to help everyone. So this is the case in short. Now for us, how do we think about this case? How do we kind of analyze about this case? This is the thought for us to think about. So in these kind of cases in today's time, we have to make a whole strategy. If we think that we are going to give one dose and that's about it and forget it, in my understanding, many such cases require very, very different strategy. So in this case, what is the main portrait? What is the main peculiar thing that I saw? Of course, the pains started around the climacteric region. There's a history of kind of taking a lot of estrogen kind of therapeutics in allopathy. The hands are very, very hot. She is very sensitive. She cries. She's very affected by suffering and pain and hospitals and death. And she's sleepless with the pain and also thinking about the pain. Almost reminds you of remedies like opium, pulsatilla. But the best results I have found are with very solid, exact symptoms. And that's what I do more and more in homeopathy. I try to find the exact symptom. And when I started studying the kind of repertory more and more, and I tried to look at the main symptom, and I was very surprised when I looked at some symptoms that I would like to show you in the repertory. Have a look. There is one symptom, pain with heat flushes, with burning in the palms during the climaxes. And I find only one remedy in that, the remedy, the Sanguinaria canadensis. So interesting, no? And only remedy in pain and arthritis in climaxes. Sanguinaria canadensis. Sleepless with pain, and all the symptoms start during climacteric period. And sanguinaria, because we are talking about sanguinaria, is a huge remedy for women's health. When you can see the rubric, have a look here. Pain in climacteric and single remedy sanguinaria. But what I want to talk to you also is that also sanguinaria belongs to the opium family, the papaverese family, which, as you already know, has a very, very deep sensitivity to pain, suffering, you know. Some more things about sanguinaria canadensis that I would like you to know. It's one of the biggest remedies for climaxes period. But where do I use it mainly for? What is the main thing that I want you to remember? The main thing that I wanted to remember in this whole sanguinaria is it's the only remedy in homeopathy which has polyps in all parts of the body. What I mean? Which means that if you study homeopathic literatures and if you look at uterine polyps, gallbladder polyp, right? Renal polyps or intestinal polyps, and of course, nasal or ear polyp. In all of that, you will find sanguinaria. So it's a big remedy for polyps. So when I think about polyp, and especially, not necessarily, but especially if I think about climaxes period and polyps, the first remedy that comes to your mind is sanguinaria canadensis. You can see here. So you can see here polyps, and you can see uterine polyps, and you can see sanguinaria here as one of the biggest remedy. Of course, there are many more remedies. And the state of sanguinaria, very nicely, the main symptom of sanguinaria in the repertory is two or three. Recognizes everything but cannot move. They can see everything, but they can't do anything about it. This is the state. And desire to be held. So they are very clingy, or sanguinaria canadensis. And they can be very sensitive, almost reminds you of pulsatilla and staphylos aureus. You can see the rubric, rage after insults. Yeah. And many dreams, especially dreams of dead bodies, snakes. And finally, a huge remedy for shoulder rheumatism. Big remedy is sanguinaria, which our patient had. So what did I do in this case? Of course, I didn't give sanguinaria. So what did I do? Like I told you, in many cases, we give sarcode followed by the individual remedy. Why do we give sarcode? Sarcode is often given to remove the block, and especially because she had taken a lot of hormonal treatments in the past. So the remedy I gave was estrogen followed by sanguinaria canadensis. I gave estrogen 34 pills 3 times a day for 7 days, and then sanguinaria canadensis 30 and 200 as the main plan of treatment from our side. And within the first 1 month, we saw that the pain gradually reduced, the back pain further reduced, and the numbness, the tingling, the suffering very, very nicely gradually improved with help of homeopathy, estrogen, and then sanguinaria canadensis. Very often in such cases, I may also use a tissue salt as a SOS. One of the very important tissue salt for me in such cases is magnesium phos in 6x. Always give it in hot water. Put 4 tablets in hot water and ask them to take 1 spoon every 6 hourly for 2 days as a painkiller. So with help of this, very often we are able to avoid the kind of or reduce the allopathic medicine. So it's more like a homeopathic painkiller, this Schussler tissue salt. Coming back to estrogen. So estrogen is one of the very important kind of sarcodes that we have in homeopathy. The main indication, and why did I give estrogen, not just randomly? Remember, whenever there is bone related degeneration, early osteoarthritis, bone related pathology, especially after hormonal treatment or around climaxes, the biggest remedy is estrogen. Yeah, this is the main keynote. If you see bone related pathology after this, after taking the hormonal treatments, after taking estrogen, think about the remedy estrogen. It's a huge remedy. And hair loss, a lot of hair fall before, during, after the climaxes, sudden weight gain, sleep related issues, memory related issues. It's very, very important. Yeah. And also gallbladder related issue, gallstones around and after that, the menopause. It's huge. That. And the most important remedies when I that I think about in especially in perimenopause and menopausal health have to be the sarcodes. And this is a very nice map that we created with help of my colleagues, Dr. Jaya and Dr. Srishti. This is also part of our new book. And this, of course, this map, the 8 most important sarcodes that I use in practice. The first remedy, of course, is estrogen 30. Somehow, I have seen estrogen more useful for patients who have taken hormonal treatments in the past and around the menopause has started getting joint related issues or digestive related issues. So this early osteopenia, early osteoarthritis, early osteoporosis, I found estrogen 30 the most useful. What I'm sharing is not materia medica, but what I'm sharing is what clinically we have seen. And of course, there is so much materia medica to each remedy, but I'm giving you just the clinical pointer, just in your clinical practice so you can help your patients. Folliculinum, in our understanding, is a little bit more for puberty and more for a stage before menopause. So if we have seen it more useful, let's say around the age of 25, 30, 35, 40. And the main symptom is that there's a history of a lot of domination and there's a feeling of a lot of pressure. Folliculinum patient constantly says, I feel a lot of pressure, pressure, pressure. The other thing about folliculinum, which I want to tell you, and I will share with you a case, I had a very bad case of an ovarian cyst during the menopause, and the woman was in so much of pain. The allopathic doctor said, get the surgery done, get the surgery done. And I studied her entire case, and she was so much in pain. She was taking painkillers every day. And I studied her case and I found in her case a lot of feeling of a lot of pressure, a feeling of a lot of domination, a lot of symptoms where symptoms are better after menses, a lot of symptoms before and during menses, the appetite increased before menses. These are all symptoms of folliculinum. And I asked her to take folliculinum 30 initially, one dose every 2 weeks. And I've been treating her for almost, I think, 3, 4 years now. And she has not used painkiller, anything, just purely on folliculinum. Her pain is being managed and all her menopausal symptoms are managed. So pains in the body, pains due to the ovaries and uterus and spasms around the menopause, I would go more towards folliculinum. We go to the next. Uforinum. Uforinum is more of a remedy for, of course, for menopausal health. But the first thing I see in Uforinum is a lot of skin issues, a lot of acne. So women who come and tell me that I'm getting a lot of, acne, my skin is getting dry. It's like a remedy for a skin specialist. You will become like a millionaire skin specialist as a homeopath if you know the use of Uforinum. So many women who come with sudden weight gain, sudden increase of the kind of water retention, redness around the skin, acne, and heat flushes. The remedy of choice often is Uforinum. Uforinum is a little better for menopause than folliculinum. Endometrium is a recent remedy that I have been using, Mike, and I found a very nice case where I was treating a case of endometriosis with infertility, and I gave endometrium as a intercurrent remedy and some more remedies later on, and her pregnancy test has recently come positive. Quite joy, a lot of joy for me because it's the first time that I've seen endometrium as a sarcode helping in the conception for the woman, and she is the patient also is a homeopath, so she was so ecstatic. And also, you know, the pleasures of prescribing, how much happy you are, sometimes a little more than the patient. So I was very happy for her, and also something new that we were able to find. Coming back, when Uforinum, folliculinum, and all sarcodes fail, we think about pituitary gland. You have to think as an axis. You know, pituitary gland is a like the boss, and the oophorinum is in the ovary, the thyroidinum is here, right? So when all the sarcodes fail, normally you think about pituitary gland, and you normally think about pituitary gland in obese women whose menses has become scanty and who has many endocrine issues, like she has thyroid, she has diabetes, she has fibroadenoma of the breast, she has uterine issues, she has ovarian issues, so many hormonal issues with huge obesity. Think about pituitary gland. Thyroidinum is a huge sarcode remedy also, and although I use it more um, for so many other hormonal health issues, the keynote is thyroidinum is generally very chilly. Obese, they look like Calcarea carbonicum. Either thyroidinum, you'll find them very, very fast, or you'll find them very slow. They have a lot of desire for sweets, lot of desire for sweets. They sweat a lot. In fact, their palms are always sweating. In fact, just today I gave one lady who came to see me just before the webinar. She had allergy. She's about menopausal health, and she had urticaria all over the body, and very chilly, and she has thyroid issues, and she's putting on weight, and she's not able to kind of lose weight at all, and very sweating. She sweats a lot. The other keynote is in thyroidinum is lot of gassy stools. So they say that when I go to the bathroom and when I pass stools, there is so much of noise. My God, boom, boom, boom. It's almost as if everyone else in the house comes and checks what happened in the bathroom. This is the important symptom of thyroidinum. So the next time you see someone in the toilet making huge noises, you should think, oh, could it be thyroidinum? The other remedy is testes, a huge remedy for women's health again. But typically, uh, when you see a lot of masculine state, whether even it's the mind state, they become mannish, they behave like a man, their desires become like a man, or they develop kind of masculine physical health with 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 the constitution, the physical constitution, the android, so the androgenetic alopecia, the hirsutism, the sexual desire. Testis is a huge remedy. And finally, parathyroidinum. This is more of a remedy which we are using more and more for menopausal women with huge osteoporosis. So this is a little bit of a glimpse of the entire materia medica maps that I would like you to keep in your mind for menopausal health. So one of the commonest other patterns that you will see, of course, in menopausal health is about the problems with dyspareunia, dryness of the genitals of the vagina, libido related issues. And definitely in these cases, sarcodes are very important, like folliculinum and oophorinum. These are the two sarcodes which I have used in these cases. If there is heat flushes is more, think about oophorinum. If not, generally I will go with folliculinum. One of the hidden gems in these cases is the remedy zincum chromatum. Is a very important and a very clinical specific remedy for this. Generally, we use it in 30 potency. You will see the constant anxiety and hypochondriasis of zinc and the stubbornness of chromium in this prescription in that patient, zincum chromatum. It's a huge remedy for dryness of vagina. In fact, one of the biggest remedies for this. Another lesson on remedies, Aeschylus hypocapsatum. Generally, the women who require Aeschylus will have a lot of problems around climaxes, including hemorrhoids, piles, and with the hemorrhoids, she will also get a lot of dryness of the vagina and will have a lot of backache, very bad backache. So a lot of backache with that, lot of dryness, not only dryness of the vagina, but dryness of the throat also. And huge remedy for lumbago, my God, for backache with hemorrhoids. And the backache during the climaxes that Aeschylus feels is as if there is no energy there. They just want to lie down. There is as if no power in the cervical and lumbar area. So they say that the backache is so much that they are unfit for work. This is typical for Aeschylus hypocapsatum. You can see this kind of thing. Aeschylus. One should always compare collinsonia. But in collinsonia, there is a lot of bleeding. And collinsonia is more of a remedy for hemorrhoids after pregnancy. And Aeschylus is more after climaxes. So this is very interesting kind of differentiation. Of course, one should never forget a remedy like graphitis in dryness of the genitals. And finally, very often patients are nowadays coming around and after the menopause. There is not just dryness of the genitals of the vagina, but a lot of itching. So they will complain to you about itching. I feel a lot of itching in the vagina, in the vulva. There's too much of itching inside. Many of them require caladium. Remember, this is also a remedy for smokers and tobacco. So many of these women are smokers and they are having tobacco for a long time. Along with this, there is a lot of itching in the genitals. And many of these women who are smokers or tobacco smokers, they also gradually develop early dementia. So this kind of early dementia around the menopause, think about a very lesser known remedy, caladium. Why caladium? Mike, it's very interesting that when Kent decided to do a proving, um, and Hahnemann decided to do the proving, all the homeopaths there decided to do the proving of caladium. The first symptom that came up was that all the provers forgot what the symptoms were. So because the provers forgot what symptoms they were having in the last few days, became the first symptom of the proving of caladium. So interesting. So this is a little bit about the story of caladium. One more important pattern that you will also often see, patients, women around the uh, climaxes, around the menopause time, they are gradually having high cholesterol, high triglycerides. And of course, in this, we need to look at integrated treatment. We need to plan a homeopathic line of treatment with changes in nutrition, with movement. And when we do this together, definitely we can help a lot of our patients with this. But there are certain homeopathic remedies which are more clinically well known for helping reducing the cholesterol and triglycerides, which are worth knowing, especially around the menopausal time. Although, as we always say, the best remedy is the indicated remedy, and we are only talking only about when our indicated remedy fails. We have so many colleagues who are watching this webinar today. All of them are very kind of experienced clinicians and who understand the importance of individualization and the fact that we have to find the remedy for the patient. It's only when this is failing that we are thinking out of the box. And this webinars that we are having with Mike is based with this, that how to think out of box. And that's what I'm discussing. The first remedy in every case have to be individualized. So which are the important remedies which I want to talk to you? One of the very lesser known remedy, and a lot of clinical research in homeopathy is being done in India and outside on this on this remedy for triglyceride and cholesterol. This is a remedy called as Guatera guameri. Very interesting kind of remedy, and they have found in some parts of northern India, they're able to do some researches for hypercholesterolemia with Guatera guameti. And the idea is to give 10 to 15 drops for about 3 times a day for 2 months. And they found that in many cases, the results were remarkably positive, which are worth noting. So this is a important remedy that you would want to keep in your mind. What I would often do is in cases where I'm not getting results with indicated remedy, after the indicated remedy, I will ask the patients to have this. Instead of taking certain allopathic medicine, why not let the patient take this? This is the idea that goes on in my mind. The other important differential diagnosis for triglycerides and cholesterol post menopause, one of them is crataegus. Of course, you know that crataegus is one of the biggest cardiac remedy that we have in homeopathy. But important thing is after menopause, around menopause, typically they find heart blocks, right? They are finding heart blocks. They are finding that there is a block in the heart. There is a crustaceous deposits, boricrites. The best homeopathic remedy is crataegus, and you can give it generally mother tincture. You have to give 6 to 8 drops in a half a cup of water. You can give it 2 times a day for let's say about 15 to 20 days and evaluate. So this is generally the very important kind of homeopathic line of treatment that I would think about for cholesterol and things like that. Cholesterinum is another remedy that are both known. This is worth knowing, and this is especially for fatty liver, along with Cardus marianus for climaxis related fatty liver. Although a more important remedy is ammonium vanadium. Cardus marianus is another remedy for high cholesterol around the menopausal region, along with kind of fatty liver. But very often I found some important carbon remedies, it's very simple remedies like calcarea carb, like graphitis, to be very, very useful, especially when indicated in such cases. So this is another case, very, very interesting strategy we used in this case. It's a case of a 46-year-old lady. And she came with a lot of perimenopausal symptoms, and I've been treating her for quite a few years. And one of the main remedy that helped her in the past, I'm saying a few years back, was Ignatia. And it did help her for a lot of her problems, including her backache, her thyroid. But she contacted us a few months back, and she described a lot of kind of perimenopausal symptoms. She was constantly talking about a lot of hot flushes, a lot of itching in the genitals, irregular menses, leukorrhea, and she was suffering a lot. This woman. So she describes her symptoms with a lot of headache, a lot of dizziness, a lot of vertigo, a lot of heat flushes, a lot of kind of fibromyalgia, a lot of pains all over the body. And her periods are becoming very irregular, very perimenopausal state now. And she's getting a lot of fungal infections everywhere. She has a fungal infection in her genitals, other parts of the body, a lot of itching in the leukorrhea. The leukorrhea is very foul smelling. It's white yellow color leukorrhea. She's becoming very chilly nowadays. And she describes about dreams, many dreams. She says dreams of someone is above her and someone is trying to press her, and she's not able to push that person and she feels numb. This, interestingly, is a very good dream for ammonium carb. So she's seeing a lot of changes in symptoms. She's getting a lot of backaches. And previously, she was getting a lot of backaches. And this would get aggravated around and after masturbation. Very interestingly, about her as a person, she has she has a lot of issues with her husband. Her husband has had a lot of extramarital affairs, and she stays in the same house with him and with her son and the in-laws, and she'll still try to remain suppressed and um, handle this situation. And she's going through a lot. And the only way that she tries to take care of her mental health is by diverting her mind, going somewhere else, going for dancing, and going for meditation retreats. She practices, which is now very popular in India, kind of Buddhist kind of mantras, and she goes to those groups where they do a lot of chanting, and she says chanting is the thing that helps her a lot. So whenever she's into this kind of Buddhist chantings, and her state of mind, her health remarkably improves. This is her main symptom. That chanting, going to the Buddhist kind of, she's remarkably better. And at a deeper level, she is very deeply suppressed, very deeply suffered a lot because of her husband. Like I told you, and with that, she's now getting a lot of sweating, a lot of menopausal symptoms. Her son is going to the US. She's very deeply attached to him, and her son going there would be very difficult for her. She feels very lonely, very abandoned based on that. She has been suggested antifungals with with this, and she of course doesn't want to take it. How do we analyze? So the biggest symptom for me here is is the fact that of course she has a lot of menopausal symptoms, a lot of symptoms of back in the past, a lot of leukorrhea, a lot of itching. But the biggest symptom is her going towards the Buddhist kind of mantras, and only thing that helps her a lot is chants. In fact, she tells me once in the consultation that only two things have kept her alive. One of them is chanting and this Buddhist kind of group where she goes and kind of really shares her experiences. And it's a group of few women who do this here. And the second, of course, is homeopathy. So this is her main symptom. So now I'm thinking, how do we analyze this whole patterns? And for me, the remedy should have a big kind of religious or big diversion as the main thing, some kind of diversion should ameliorate them. This should be the main thing in the remedy. And of course, I thought about the biggest remedy which feels better after diverting the mind, which is very important for menopause. Yes, we are talking about a very important remedy which is very underused. We are talking about helonias. My God, what a remedy this is. One of our colleague just asked, which is the remedy for a lot of weakness during menopause. One of the biggest remedies, helonias. Of course, it belongs to the lily family, and the deep connection of lily family with religiousness, with chanting, with praying, with mantra, with with sexuality, with sins, with right, with wrong, with moralities, and the whole story. So the Helonious person is a person who's very, very, on one side, very, very affectionate, very, very worried about the family members. And this is how she is also, but also much better by occupation, much better by diverting the mind, and has a lot of menopausal weakness. Yeah. It's supposed to have more menopausal weakness than CPI. It's very deep remedy for menopausal phase. In fact, a very important remedy for uterine and kind of vaginal prolapse, which we will also talk about a little later. So what did I do? I gave Helonius 30 two times a day for 2 days, for 7 days, and then 200. This is an ascending potency which I use in patients who are suffering a lot. And then because she was getting a lot of kind of fungal infection, a lot of candida infection. I gave her a Sarcode, Candida albicans, after 2 weeks. Candida albicans 30, 2 times a day for 3 days. This is a huge remedy for removing the tendency of fungal infection, candida infection from the root. And this is a remedy I have been using quite a bit in some cases wherever I have used for vulvitis, vulvovaginitis, for linear eczemas around the genitals, especially recurrent fungal infections, recurrent genital infection. They have a lot of desire for very high calorie food and a lot of dreams of brutality, murders, bombs, rape, and a feeling of a lot of forsaken and abandonedness and feeling as if defenseless and being eaten up. This is also a very important remedy for dermatosis following antibiotic use. So, someone who has taken a lot of antibiotics, antifungals, this would be a very, very crucial and important remedy in our practice. And just with that, within a month, her, she felt so much better. She felt 90% better, and her itching, her burning, and so on improved. The leukorrhea also improved. We went gradually from Helonius 200 to Helonius 1M. Now she's on Helonius 1M, 1 dose every month, and her leukorrhea, her itching has been better. Her pain, her weakness has been better. In fact, her thyroid has also improved. She was having hypothyroidism almost 7.8, and it is now recently 2.82. So she has done well overall. Very, very interesting and a lesser known remedy, Helonius dioica. Always better by attention, diverting the mind. This is the keynote that is worth. And also, these women have had a history of recurrent abortions in the past. This is the other keynote about Helonius. Interesting, no? Yeah, interesting. And because we were talking about kind of uterine prolapse and uterine displacement, and you can see here, because there are so many remedies for it. But one of the very important remedy that I have used a few times is a remedy called as Malcolm Sal. This is a very interesting remedy. Malcolm Sal. You won't believe what this remedy is. Yeah, this is a remedy we are using a lot for uterine prolapse as one of the first remedies in practice. Honey with salt. Can you imagine? In boric. So it's one of the biggest remedy for uterine prolapse and chronic endometritis. And with that, when you see a sub-involution of the uterus, this is a very, very important remedy in 30 potency that you have to frequently repeat for a few days, maybe 10 to 15 days. It's one of the hidden gems. See, in homeopathy, there are many old hidden homeopathic remedies which we are not using, but there are some remarkable remedies which are old and forgotten but can really help heal a lot of menopausal related issues. So this is a remedy which I want to point out to you. And the other remedy which I want to point out to you, which I'm very, very using a lot, which is very important, is is a remedy for menopausal health, is the Electris ferinosa. It's very interesting, Mike, that many remedies from lily family, whether it's Helonius, whether it is Electris ferinosa, whether it's lily family, have a very good action on uterus, have a lot of action on infertility, have a lot of action on hormones related to the ovaries. And if we just study many small remedies, you'll find a very interesting pattern that we are trying to understand and develop. in menopausal and perimenopausal health. Elytris farinosa, how do we remember this? Is very interesting. If you see in a women around the menopause, around the perimenopause, just very tired. It's like a uterine tonic. The old classical homeopaths called Elytris farinosa as China of uterine symptoms. My God, can you imagine? China, the main symptom of China is exhaustion. No? So that's the thing. So, for example, in a place like India, where not everyone can have vitamins and supplements, and there's a lot of weakness, and they don't do self care, this is such a important remedies. Elyteris farinosa, and you can see the main symptom is tired and very women with defective nutrition. Elytris farinosa, huge remedy. You can see the symptom in boric. I always told you, whenever you read boric, and I hope that me and Mike one day we will have a very nice session on how to study Boric Materia Medica and repertory, which we already are planning to record and we will share hopefully at some point with you. One of the main things I told you when you read this old Boric is always read what is written in capitals. That is the key clinical feature. And the main symptom you can see in Elytris farinosa, see very nicely, tired all the time, suffers from prolapse, leukorrhea, rectal distress, and so on. And the state of mind is there is so much of weakness, their mind is confused, they are not able to decide, they are not able to concentrate. And you maybe you're giving CPR. So many CPR patients who are not improving, Elytris farinosa. So I've written very nicely, have a look. Weakness plus uterine symptoms. Think about Elytris farinosa, and especially when CPR fails. And always remember this remedy, Elytris farinosa. Always remember to use it in very low potency, either 1x or 6 or 30. This is the potency that I like to use Elytris farinosa a lot. In some cases, in some menopausal women, there is a prolapse of the uterus, and this is, of course, because when the gynecologists see, they say that uterine ligaments are weak. So there is a lot of weakness there. The very important remedy in such kind of cases is Lappa, and it belongs to the compositive family. Okay? You can just cross check it once. Yeah, and with this prolapse, there's a lot of pain in the uterine region. Almost reminds you of Bellis perinus, and they also get a lot of acne around the menopausal time. So this is a little bit about LAPA. I'm giving you a lot of clinical hints here. Many women develop premature menopause. Their ovarian reserve is affected and they develop what is called as a premature menopause. The remedy of choice in this kind of cases I have seen is uforinum, which I will give in 6 or 30 potency, and then followed by the indicated remedy. But one of the biggest remedies which I want to tell you for this kind of early premature menopause or so on, which I want to tell you, is a remedy, again, very forgotten remedy. And I'm trying to share with you very small remedies that can change the entire dynamics for homeopathy. Is a remedy called as absinthium. This is a very important remedy that normally don't think about. Boric writes it's the only remedy in our homeopathic literature where you see premature menopause. It's a big remedy. So very often with premature menopause, in absinthium, this remedy, you'll also see a lot of insomnia, and you will see a lot of hallucination, and you will see a lot of vertigo and a lot of spasms of the face, and you may see a little dementia also in these cases. So it's a it's a much lesser known remedy, but a hidden gem that I want you to remember, the remedy absinthium for premature kind of menopause. And the other remedy for premature menopause who has a lot of swelling on the body is the remedy Apocyinum cannabium. This is a huge remedy for early menopause who suddenly all over the body develop dropsy on the face, on the legs. Apocynon cannabium. It belongs to the Apocynaceae family. The main sensation is of kind of uh, gradual expansion and shrinking. And these patients who require apocynon, they are very, very chilly. And suddenly they have a amenorrhea, they have a bloating, there's a stomach getting dilated, and irregular bleeding happening. This would be apocynon. Give it in very low potency, apocynon cavity. So this is a case of a perimenopausal women who had come to see us. And you can see she was diagnosed with infertility. All her reports were okay. And she took a lot of treatments in the past from so many doctors. And I studied her case, and her case turned out to be a very, very beautiful case of pulsatilla. But unfortunately, pulsatilla, although it was indicated with a typical state of pulsatilla, it didn't help at all. And I tried giving different potencies of pulsatilla, but it didn't help at all. So in these kind of cases, one of the things that one would like to do is look at a SAR code, and that's what I did. I gave uforinum. I gave uforinum. I gave uforinum in 30 potency. I told you it's the most important SAR code for perimenopausal phase. And after that, so I gave uforinum 32 times a day for 5 days. And then after about 15-20 days, I went back to the indicated pulsatilla and continued giving this. And at the end of a year, beautifully, she was she had kind of a spontaneous uh, pregnancy, the conception, gestational age, everything went very, very well. Can see here. And, all her reports, you can see the sonography, everything went okay. The fetal anomaly wasn't there. And of course, she did very well. She has a young daughter now who's also our patient, and we have an entire testimonial of it. And this is one of her pictures that she sends us, where she becomes a kind of a very important Indian uh, freedom fighter. So yeah, it's a lot of use of SAR codes, especially in menopausal health. Edita asks, do you address uterine prolapse locally or constitutionally, or may combine both? You can give the constitutional treatment, but I have found better results in such kind of pathological cases where I have given the indicated remedy and also later on used certain local remedies, organic pathological remedies, and that can really help um, the health and especially help to stabilize the pathology. May require a pathological prescription, and this is how our masters treated, including Boger, Lippi, Burnett, and they had remarkable pathological cases. Any tips on how to treat lichen sclerosis with itching during menopause, Edita? Hello, Edita. So you will have to, any kind of lichen, no, generally requires a more deeper indicated remedy, and it's generally, in my understanding, most cases that I have seen with lichen planus, if you give a remedy based on mind and body connection, you will see better result. However, I have treated cases of lichen sclerosis with the indicated remedy, of course. But one of the local remedies that I would like you to study is a remedy thiocinaminum. This is a very beautiful remedy. You could use it in 6C potency or even lower, and you will have to give it more frequently. This is a remedy that can absorb kind of thickening and kind of you can say sclerosis. Read about it from Borick and Clark. And do read it before you prescribe. So that will help you. And you will have to give it frequently for some time for really good results. Another thing for which very often women come to see us um, around the menopause is thinning of hair. They say the hair is thinning a lot. The most important remedy we have used when they say around the climax is suddenly the hair thinning, we are using the remedy thallium metallicum as a very, very important remedy as an intercurrent, 30-200 for a couple of days. And of course, you know all the acids which are so important. You know the sarcodes are also very important in hair fall. CPI is the only remedy that is well known in Fatak. But I would really definitely tell you to read Thallium Metallicum. Read the first line of Thallium. It says that it specially acts on the pituitary gland. The other very important question that one of our colleagues asked, sleeplessness, yes, during climaxes. Senecio, I told you, would be a very important remedy, especially along with the backache and all the other symptoms of composite. A lesser known remedy which you can use in mother tincture form, especially with sleeplessness, is a remedy called as Pisidia. It's a very small and hidden gem that I would like you to remember. Pisidia. Yeah. One of the hidden remedies in such kind of cases is a remedy called as Hirudo. It's a remedy prepared from leech. Okay. And it's a very important remedy for, it's also known as Sanguisoiga. Okay. So it's a very important remedy for bleeding when all remedies fail. Another remedy is sedum acre, which is also very important for this kind of bleeding around the menopausal phase. You know that this is sedum acre is the number one remedy we have for fissure in the anus, which is small house leak, you can see here. And they get a lot of burning after stool, this remedy, but also very important remedy for a lot of flooding and flushings around menopause time. Yeah. But remember sickle core, that would be important remedy. And finally, of course, you have to find a more indicated remedy. Fungi with so many indications for fungi, but especially a lot of metroradian bleeding around the climaxes and generally dark offensive bleeding. You would think about fungi remedies like sickle core, Eustilago. These both are very important menopausal bleeding remedies also. My books are available now. Nosode Sarcode, Decoding, the books on maps on acutes, value of repertory. This is available now in Germany, Austria, everywhere. So I invite. So, for all of you who heard this podcast and found it interesting, um, and who have heard it properly, you write an email to us, gaurang@gmail.com. That is GAURANG@gmail.com, and you get a special repertory that we have created for infertility and hormonal issues. You get this from me. You have to email us. And of course, our courses are there, our new courses on musculoskeletal and autoimmune disorders, which is going on. You get a special discount on it. And also our books. And I've written a few books, Decoding Mental Rubrics, Materia Medica of Nosors and Sarcodes. My new book is on um, homeopathic healing in hormonal healing and women's health. This is the new book that is very special, and I hope that you all have a copy of this book and you find it some of it interesting and you can apply some of it in your practice. Thank you.